Today I'm talking with Troy Malone out of Portland, Oregon. He's going to be talking with us about his experience with hip impingement surgery. Years ago, he was told that his hip pain was a result of bad bone shapes and that the only solution was to get hip surgery. He didn't really want to get the surgery, but he did. He ended up getting it, and in this interview, he's going to share what happened. He's going to share what the aftermath was. He's going to share what he learned from his surgeons after the surgery was already completed. And he's gonna talk about what he has learned during the recovery process as he's been trying to build his hip mobility to bigger and greater ranges of motion than he ever had before. If you or somebody you know is considering hip surgery for FAI, it's really important for you to listen to this interview. I hope you find it helpful. Here we go. All right, Troy, thank you so much for joining us from Portland to talk with us about your hip impingement experience and your hip surgery and all that. So I want to start from the beginning. Can you talk about kind of the onset of symptoms and what you saw happening to your body that eventually led you to hip surgery?
I was probably in my late 20s, early 30s, and started getting restriction pretty bad, and definitely some pain, pretty severe pain. I started getting some popping, snapping going on, which I thought at the time led me to more of like maybe I needed stretching and yoga. So I dove into hot yoga and started doing that 4 or 5 days a week, and that cascaded me pretty quickly. That brought me into a pretty severe pain state, to the point where then I saw a doctor. So I think there was probably a 6-month period there where it just declined really rapidly.
So can you kind of explain where the hip pain was, and then what did you notice was making it worse while you were doing hot yoga and all that?
Yeah. For me, it was always in the inner groin area. So on the kind of adductors, maybe high groin, high thigh area. And then I was getting some low back symptoms. My back would kind of get thrown out. And I just kind of thought that, at the time, I thought that was a separate issue. I came to realize that they're pretty connected. But yeah, it started in the groin area, and then it kind of did spread to the outer hips, and then kind of all around that hip region.
So before you started the exploration with yoga, what activities were you involved in that would fire up this groin pain and hip pain?
I've always been pretty active, younger, kind of high school stuff, played sports, football, baseball, basketball. Into my 20s, I got into rock climbing, surfing, kind of mountain biking and hiking, a little more of those extreme sports, snowboarding and things like that. I didn't see much restriction until, like I said, the 30s. I started not being able to bring my knee to my chest. So I noticed it first in climbing. I was limited on my hip mobility to kind of put a high foot up. And then, that's, like I said, I thought yoga and stretching would help, but I think that's where I saw the restriction was in some of those. And surfing was another one, Matt, like not being able to kind of pop into that squat position. Definitely noticed that. I just thought I was tight. Maybe it's a tight day. I think I thought it was normal. But those are the sports I was doing prior. And like I said, looking back, I definitely saw even back into high school, as I reflect, I can remember times when, I couldn't quite do the exercises, the movements that everybody else was doing, especially putting my legs out wide. I noticed restriction or boxing out or some certain athletic movements, deep squats, things like that. Other people could do them. I couldn't. I didn't really pay much attention at the times. I didn't have pain yet, but I did notice it. And as I'm reflecting back, I'm starting to even go back to like freshman year and remembering some exercises in class and stuff that I'm like, wow, okay. So it's interesting.
So it's kind of a common thread that happens with a lot of people, I think, where as you develop the knowledge of your body and you're trying to fix it, you start to look back and you see, wow, There were clues all along the way
Mhm.
that I just wasn't paying attention to. So let's see. So then you were very active. You were doing all these things. Your hips were getting worse. You did yoga and stretching, and that actually started to make things worse. You started feeling more pain around the outer hips. So then tell us what happened when you went to see a health professional. Was it a doctor first, or what happened?
I think there was a time specifically. So within the yoga, at some point, it got really, really, really painful. Like 10 pain, snapping pain. There was some sort of snapping. I'd go to do a movement, and there'd be a restriction, and then there would be this snapping sensation that would almost make
Mhm.
me sick to my stomach. And it would be a sharp 10 pain for a couple seconds, and then it would kind of subside, but it scared me completely because anybody that's felt that, it's pretty intense. So that led me, and then what would happen, whatever position I was sleeping in, sometimes I'd wake up in the middle of the night and I'd go to like move or roll over, and the snap would happen, and I would just scream in the middle of the night, and
Oh my
my
gosh.
wife would be like, "What?" Yeah, and so yeah, initially I saw a doctor. That's when I finally went in and saw a doctor. Had no previous diagnoses of any sort, but they quickly referred me to a specialist who did refer me to. I started with a bit of a PT approach initially, where they were looking at physical therapy, but they quickly looked at me, and said, "Oh my gosh, you're really bad. I think you need to see a surgeon.
Wow.
There might be something going on. Have you gotten MRIs and X-rays?" And at the time, I think I had X-rays, but I didn't have an official diagnosis
Hmm.
yet. And then when I saw the surgeon, that's when I did officially get diagnosed with osteoarthritis, FAI, torn labrum, a cam impingement. 80-year-old hips was really they kept saying that to me, and that stuck with me, because it's like, you're in your 30s and you get told you have 80-year-old hips, and you don't really know what that means. I had no really background in anatomy or anything at that time.
Hmm.
And so, yeah, it was scary, super scary. And I think it was tough. It's tough to hear that, but the surgeon said, "Hey, this is pretty common in your age, and we have this new surgery that, here's what's going on with your body. You have hip impingement, you have bone spurs on your hip, you have a torn labrum. The good news is that we can do a surgery where we shave off the bone spurs off your femur and clean it up, and then you'll move freely. You'll have free range of motion. You'll have free restricted movement." It's when you hear that, Matt, it's even now, man. I mean, the perspective, like when you hear someone give you a solution and you're in this scared state, it's your mind wants to really take that solution, and so at the time, it made sense to me to consider surgery, and then
Yeah.
this was in 2015. I did have quite a bit of family members and people reaching out to me and saying, "Hey, Troy, be careful. You're young. Hip surgery, that might not be the thing." So
Mm.
I had a few people kind of advocating, and I did look it up, Matt. At the time, like I can't recall, but I don't remember seeing anything from Upright or anything else at the time.
I actually in 2015, there was probably no information at the time you were searching about it.
Yeah, and I wish, like, in hindsight, I wish I would have dug deeper. But at the same time, like, this was my journey, and I did what I thought at the time was the best decision at the
Okay.
time, and it sounded good, man. It really did. I remember, I've always, I've joked about this with other discussions, but at the time, I remember thinking, like, I've always wanted to kind of kick my legs out wide and do some of these athletic abduction movements. And I was thinking like, oh my God, I'm going to be able to do this. Like, this is amazing. There's just a bone problem this whole time.
So then what happened? So obviously the
Yeah.
solution sounds great. The surgery always sounds really good.
Yeah.
So what happened after you had hip surgery to fix hip impingement and arthritis and labral tears? What was the outcome for you?
Yeah. I mean, before I touch on that, there's another warning sign that was a big like light bulb that went off was, hey, like my left hip, I don't have much pain, but I know I have the same restriction. Like some of the movements are restricted. Does my left hip have this as well? So
Okay.
we did the exact same tests, X-rays, MRIs. They put this dye solution in to kind of
Oh, you got that
see
one.
the imaging. Yeah. And turns out my left hip was worse on the imaging. And so I was like, whoa, wow. So this was genetic or something? Like both hips were really bad. They said, yeah, your left hip's worse. We should operate on both of them.
Okay.
I was like, cool, can we do them both at once? And they
Mhm.
wouldn't do that. But then I did question, like, then why can I do these movements on this side without pain? Like there might have been pain at the extreme range of motions, extreme flexion, extreme external rotation. There might have been a little pinchy, not even pain, maybe just pinchy.
Mhm.
But why am I able to do these movements on this side and not on the right side if the left side's worse on imaging?
Right.
And they said, imaging, like based on imaging, we might not, when you get in there, it could be a little different was kind of the answer. So we might not know specifically within imaging exactly, but we can tell that the imaging's worse on the left than the right.
Okay.
But it was my first, light bulb kind of moment where it did get me thinking, okay, that really wasn't the answer that I wanted. There wasn't
Right.
to that. So, but I ignored it, and yeah, I ended up having this surgery in 2015, and yeah, on the right hip, and I had the left hip scheduled for later.
So what happened with the right hip after surgery in the month after, in the 3 months after? What did you notice?
Yeah, I mean, one thing I want to point out with the surgery. So they said we're going to do this surgery. We're pretty sure we can fix you at some point in your life. You're going to need a hip replacement, but this is going to delay it, hopefully, 20, 30 years. So,
Okay.
I wasn't coming to grips that I needed a hip replacement. But another thing they said is that based on when we get in there and look at your hip, we might need to do this procedure called microfracture. And
Okay.
you don't know. You basically go under the knife and you don't know if they're going to do microfracture or not. If you do microfracture, you're non-weight bearing for 6 weeks.
Okay.
So you wake up and you basically, I was crossing my fingers. Hopefully I don't get microfracture. I wake up. Turns out they did microfracture. But you basically sign that away and give the surgeon the right to do it. And rightfully so, that they potentially know. So it turns out she got into the hip and it was incredibly worse than she thought.
Okay.
A lot of inflammation, to the point where maybe she should maybe potentially even stop the surgery. She did her best, but they did do microfracture, which is basically where they drill or make little holes into the femur to promote healing or blood, to try to regrow your barrier there. So there's a little bit of a barrier, that labrum barrier. So there's some sort of barrier between the bone and the socket, which makes sense at the time. Again, like the surgery did. But the problem, I think, is that post-surgery, you're non-weight bearing for 6 weeks. And so I got out of surgery, and when I did go to PT, they really babied me. Oh, you had microfracture. Matt, this is one of the top surgery centers in Portland, Oregon. Top PT programs. I mean, I felt like I was in good hands. But I also felt like, honestly, PT in the beginning was, I rode the bike for a little bit on almost zero setting. And I don't remember when I first started that. And then literally they would just take my leg and just kind of do this.
Just move it back. Okay.
just a little bit of rotations. And I was like, okay, like I maybe this microfracture, like they're really careful. And so I was really patient. This lasted 6 weeks. Then I started slow weight bearing. So I think it was, 2.5 months before I even really started doing any sort of musculature activation, anything like that.
Mm-hmm.
And so about that 3 month period, I really noticed that my hip was frozen. Like there wasn't any movement. So it wouldn't really move externally. It wouldn't really move internally. It wouldn't really go into flexion. It wouldn't really go into extension. It wasn't really able to move. Like they kept saying, stop being guarded, stop being guarded. They would try to move it manually and
Mm-hmm.
it wouldn't move. The muscles, they'd stop being guarded, stop being guarded. And so we'd work on relaxation and a little bit of massage, things to try to relax it. But the muscles were guarding, but the hip was starting to get frozen. And my theory is that microfracture, maybe it can work, but it started off on a knee. When I looked into microfracture, it started off on the knee and it moved
Mm-hmm.
into a potential hip
Mm-hmm. That's yeah.
solution.
Yeah.
And what I think it did for me, and I would say for people listening, be careful with this because I think it acted like a glue, and it essentially glued my femur to my acetabulum. And
Oh,
so when I
really?
went to move, the pelvis would move, but the femur wouldn't move. It felt stuck.
Have you been able to get the movement back?
Yeah. I mean, we can get
Okay.
into the journey.
Okay.
For sure. But and I didn't know this at the time. I really didn't know this at the time. So I guess at about 3 months, I started getting a little bit worried. That was the first time. They said, Troy, don't worry. This takes a year. Sometimes with someone like you, this might take even longer. This might take a couple years to get your range of motion back.
So when you were first told about getting hip surgery, what was the timeline of recovery that the surgeon told you? So she said, hey, you're going to have great range of motion after this. All these things you couldn't do before, you're going to be able to do. What kind of recovery timeline did the surgeon give you before the surgery?
Yeah, I think it was somewhere in that 6 months to a year
Okay.
of expected, depending on how bad it is, and the microfracture, things like that. It could take
Okay.
up to a year.
Okay. So at the 3 month point, you're starting to develop a hip that moves far less than it did before.
Mhm.
And then you're starting to worry, and they're saying, be patient. So
Mhm.
what happens next?
I walked the line. I was patient. I kept doing PT, kept doing it. They said, "Hey, let's be patient. Let's stay the course, and see your doctor at the 6 month follow up." So I was like, "That's fine." If it is like injured and inflamed, maybe at some point. They kept saying, a lot of people get better, at that year mark. So
Okay.
I wasn't that worried. They were really reassuring to me.
Okay.
I felt like I was in good hands. So Matt, it just got worse, man. Like when I hit the 6 month mark and I was starting to walk, I'm full on limping. There was like, it didn't feel like there was really any range of motion in the hip.
Right.
Especially now looking back, like I was compensating. My hip was hiking as opposed to, so every step
You're
there
lifting your
wasn't.
whole pelvis
Yeah.
to, yeah.
Yeah. And I didn't really realize it. Like we worked on walking and things like that, but no one was really pointing out like, hey, your pelvis is moving up, not your feet.
That
So
seems important. Yeah.
yeah. And they were so worried about the microfracture thing. So that I was really babied. And I don't know if that's typical, but I was really babied in PT. We weren't forcing range of motion. We weren't really like working, stretching the joint and things like that. So at the 6 month follow up, we see the doctor. She saw the range of motion and she got a little concerned and said, "Hey, I think we need to do X-rays and potentially another MRI
Mm-hmm.
and kind of see what's going on. Like, I think you should have more range of motion at this point."
Okay.
So we did imaging. I saw her again on a follow-up appointment, and yeah, this was a little scary. So we looked at the imaging, and her face kind of dropped, and she had a hard time saying it, but like, hey, Troy, all the bone grew back worse, significantly worse than it was pre-surgery.
Mm-hmm.
Sorry about that. Something's going on. You might have an autoimmune disorder.
Wow.
Yeah, you might have this. She was excited in a way that, like, I think I can help you. I trained under some really cutting edge doctors that I'm going to ask for their advice. And, this is a super interesting case. I've never seen this before. Well, we're going to figure this out together.
Okay.
Was the message I got.
Okay.
I left that day saying, cool, I got an advocate, like someone, we're okay. So whatever's going on. I got referred to a rheumatologist to see about an autoimmune condition.
Mm-hmm.
But I felt like my surgeon was advocating for me.
Right.
So,
right.
Yeah, down the rabbit hole of seeing the rheumatologist and putting me on like an Advil twice a day or ibuprofen twice a day. And then they wanted to put me on even a higher anti-inflammatory type drug, which caused a lot of other problems. Like at this point, Matt, like I was hard to move and painful to move. So I was sitting a lot more. Everything was painful.
Oh, no.
Painful to move.
Okay.
So I remember, man, I started like my shoulders are rounding and I'm like, I think I need shoulder surgery. Everything just started really cascading my spine. Like, the whole body was just kind of closing in on itself.
Yeah.
And I didn't know at the time, like, man, maybe this is an autoimmune thing. So at the 3-month appointment follow up with the surgeon again, I show up just really expecting a lot of answers. And
so this is 9 months post surgery, right? You had the 6 months with the doctor and another 3 months. We're at 9 months, right?
Yeah, okay. We're right about that 9-month mark. And this is brutal, man. I go into the appointment and I see her PA, and the PA was great. She pulls me up from a chart. I wasn't expecting her to know who I was, but the surgeon walks in, no idea who I was.
Oh.
No idea about our previous conversation, pulls me up on the chart, like is trying to gather information on the chart. And I can see this going on. And I'm like, oh my gosh, what? So she's kind of, it's starting to come back to her. And I'm like, hey, did you consult with that doctor in Vail that you talked about? All these questions that I had for her. Big list. And she just unfortunately didn't, and was busy and, was apologetic, but like, I'm sorry. Yeah. And then left and said, hey, I think you do have an autoimmune disorder. Keep seeing the rheumatologist. I think your next thing is a hip replacement. I'm sorry. Yeah, man. And that was dark. That was brutal. That leaving that hospital at that time was a tough. Now at this point, everything's painful. My whole body's painful from the spine to the hip to the shoulder to I can barely walk. I was having trouble walking down the block.
I mean, this is a pretty dark period. And now with your whole body hurting, I could definitely see somebody in that position saying like, well, maybe the doctor's right. Maybe I've got this autoimmune thing because now my whole body is hurting. Did you start chasing that down? And then what, and then how did you end up going a different direction?
Yeah, I did, man. And the autoimmune thing, everyone, there's a lot of opinions on autoimmunity. But I think be careful with that diagnosis because they're not honest with what they don't know about autoimmunity. If you really dive into it, it's a diagnosis of, we really don't know. We're doing our best to figure it out, but we don't really know. And what it did for me was completely just destroyed my gut. Like whatever the ibuprofen twice a day, and I forgot exactly what I was taking. I'd have to look back, but I was taking a lot of anti-inflammatory things. It got me severe heartburn to the point where I was having to take Prilosec every day. I just kept getting prescriptions, and
So it's just more pills on top of pills on top of pills. Okay.
and so I really hit a point where I was like, I'll touch on this later too, like alignment, like where are you going? Like where is your trajectory? If you continue where you're at on this timeline, where are you going to be in 5 years? Where are you going to be in 10 years? And it scared the crap out of me. Like at this, where I was at in that stage, if you continued that out, it looked like I was going to be dead in 5 years.
Right.
Or like I couldn't eat certain food. Like everything was broken. Like my whole body, digestion, like it all, I had pain, movement. I mean, I would lie to my friends like, hey, do you want to go on a climbing trip? And I'd be like, oh, hey, I can't make it. And it was always, I can't make it. Really, I was in too much pain. I was in too much pain. I couldn't do it. So yeah, but in a way, I think for me, going through that really tough, dark time, there was a strong point where I realized I had to advocate for myself.
Right.
I had to advocate for myself. I had to take some of this into my own hands, and it felt daunting. But a piece of advice for people listening is, I think at some point you have to really take it into your own hands, at least a bit, because it's too important. Like your body's too important, and it's too unique. Your problem could be unique, and for me, taking it into my own hands was the start. So I could start my alignment. I could start a different journey. I could start to attempt to make this better. And so I started looking for solutions. Yeah. I mean, so I think that was a start. And that might have been the year mark. I don't know how, I might have been in sorrow there for a little bit. I'm not sure on the timeline, from that 9-month mark to where I like really started to say, okay, like, let's figure this out.
So you basically, I think it's really helpful to think about the trajectory. That's something I didn't ever explain it the same way, but it is exactly the same. When I had an MRI at the age of 22 on my knee, and it was hurting so much, and the doctor basically said, well, there's nothing wrong actually in the MRI. You're probably just using your knee too much. You just need to rest more. And, that was already after 3 years of resting, and the rest of my body was already hurting. And I just thought, wow, if I keep resting more, what is this going to get me? Like I'm just getting worse. And can I do this at the age of 60? Can I possibly rest more than I'm resting now? And will it make me a better athlete? Will it make me better at doing what I want to do? I don't think so. So you started seeing the long picture on this. You applied it to your body. You're thinking long term, this is not working. So how did you end up? You ended up coming to Upright Health. You found us somehow, and you started thinking that it might be a good idea to move your body again. What got you thinking that way?
I think the start was, first advocating for myself, trying to figure it out. I quit all the rheumatology. I quit all the anti-inflammatory stuff, which cleared up my heartburn, which cleared up my gut, which started making me feel better. I felt like a human again. And in some ways, like I was eating food, I was not having digestion problems, things like that.
That
nice.
Made
me, that made me feel like, okay, that worked. Like, what if maybe there is solutions to this on your own, maybe we can't figure this out. That led me to, I think I started the FAI Fix, which was great. Amazing program. Shout out to you and Shane, which I know I've kind of worked with you both throughout this journey. I started the FAI Fix, amazing program. It really opened my eyes to what your musculature can do to fix your bone. It really, for the first time, gave me the sense of like, there's a skeletal system, and does that skeletal system move on its own?
Right.
Yeah. And it was like a freaking light bulb ding moment of like, oh my gosh, muscles do move the bones. Why didn't I, why didn't I think of that? And actually, Matt, before I should preface this, prior to that, I think I saw in my journey, even before the FIF fix, or maybe incongruent, I sought out every practitioner. So, and I had fun with it in a way, because I just was like, I'm going to figure this out. I'm stubborn. I'm going to do this. I don't care if you think I need a hip replacement, but I'm not going to do that. And I'm going to be stubborn. So I saw PT, I saw Rolfing, acupuncture, Egoscue, and I got a little bits from each one, and I learned a lot from each one. And I would ask a ton of questions like, "What are we doing? Why are we doing this? What are we trying to achieve?" And I slowly started to like paint this picture, figure out this puzzle. Just really slowly of kind of what was going on, incongruent with the FAA fix, I think, and starting to figure out what wasn't moving properly and what wasn't working. And then eventually I did kind of realize that, okay, I understand the exercises that I'm supposed to be doing here, but I think the missing piece for me was not feeling them correctly, compensating during these movements. So it's really tough, I think, for someone who, I think at post-surgery, I lost all connection to this right side glute muscles completely. So trying to do certain movements without the muscles firing, that mind-body connection was completely lost. So you're supposed to do these certain movements, but I would always get back pain or oblique pain or certain pain doing these movements because I wasn't firing the right muscles.
Right.
And eventually, when I came to upright, I learned that we have to get these muscles firing. Like the objective here is the right muscles have to fire in order for you to get better, or at least get this range of motion back.
Right.
And that was another eye-opening kind of aha moment for me, is kind of figuring that out. So, I kind of went through the rabbit hole of trying to figure out, how to get that mind-body connection, and, exploring a bunch of different things on how to get the right muscles firing.
So you did a bunch of work with Mitch, who was training with Upright at the time, and you guys worked pretty hard to reactivate some of your hip muscles. Yeah. What kind of was there one strategy that you found really, really helpful in waking up some of your hip muscles?
Yeah, I mean, it's kind of a neat puzzle, right? It's a journey. So you kind of you unlock one thing in the journey. You might unlock one thing, and then it just opens up another thing that you have to explore and unlock. So along the path, and I think the more broken you are, the more restricted you are. You might just have to keep unlocking and unlocking and unlocking and unlocking until you eventually kind of get to your goal. So in the beginning, I mean, the hip was frozen. And it's funny, Matt, before I saw you guys, I actually made a pretty ton of progress. I remember Mitch being kind of blown away when I said that, because I really dove into stretching and massage a ton, which made a massive difference. It really did. Like, I got range of motion. I just couldn't hold it. I was having a problem where I would get range of motion and then it would just go back.
Yeah.
I was running into, I'm like, so I know that it's something's working here. I'm able to do it. I couldn't quite, kind of finding the balance of strengthening or activating muscles, especially the right muscles. I've said this a lot, like another aha moment for me was that, a tight muscle could be a weak muscle. I didn't really get that. And I think for people listening, just because something is restricted and super tight and painful, I've come to realize now, like what that pain, like the pain sensation of a weak muscle is different than a tight muscle. And, the more you dive into the body and body awareness, you kind of pick up on what a tight muscle and the way your body reacts to a weak muscle. The good thing with that is you can strengthen a weak muscle if you can get that muscle firing again.
Yep. Yeah, so that's a good learning piece. I actually have an article on the website which we'll put in the show notes, a link to that in the show notes. Basically talks about how you deal with tight muscles and how to think about those, right? Because the conventional approach in massage and personal training and PT, the way everybody looks at it is if it feels tight, it's a muscle that you need to loosen and stretch. And that may work for some situations, but like you're saying, if you don't have the strength or that muscle is just really weak, it can still feel tight. And loosening it is not going to do anything. It certainly won't fix your problem. So yeah, good to touch on that.
Yeah.
You also had a dream at some point. I remember you mentioned this in another conversation. You had a dream about what your hips could do and what you would be able to do. Can you share that a little bit?
Yeah.
Like an actual dream, because it just blew me away to hear it. So
yeah, it's kind of reoccurring, man.
Nice.
I feel like I don't know how spiritual people are, but yeah, for me, I think I was hopeful that I could fix this. I was super hopeful that I could fix this, and so the dream to me was, I think, showing me where I'm going to be at some point. So the dream is I'm stretching and I'm kind of doing the pancake splits, and my legs are, I'm almost in full pancake and I'm just moving freely through the position. And my wife's there, and there's a gentleman that comments and he says, "Oh man, you're so naturally flexible." And so impressive. You're so naturally flexible. And I look over at my wife and I kind of give her a little wink, as if just knowing that it isn't naturally flexible. It was years and years of work put into specific work to get this. But it was, and that's kind of the dream. But I'm older. I don't know where I'm at, but I've had it multiple times. So I feel like that's the Troy that I'll achieve that someday. I think the dream, I don't know when it is. Maybe it's 5 years from now. Maybe it's 10 years. I hope that it's 5 years, and I'm working towards it being sooner than later. But it is, it is what it is. But it's cool. It gives me hope. It gives me passion that you can achieve that. And the community, the movement community, you guys, the educational piece out there, you can fix a restricted body. You really can. And you might, like, the journey might not be linear. I've heard this.
It's never linear.
It might be painful, and I've had so many painful stints where I've said, "Oh my God, is what I'm doing right? Like, maybe I do need a hip replacement." But I committed to consistency, and I committed to doing something for my hip on a consistent basis, which for me is daily. Depending on how restricted and kind of broken you are, it might need to be daily, if not twice a day. But I fully committed to that. And so, I will become the person in the dream. And, on the time frame, like, everybody's body's different. I think, if it takes a little bit longer, if it takes shorter, so that's fun. I do get, and I will say, Matt, it gets easier. I think as this journey progresses, it's been a wild run for me. That was 2015, and we're well into 2021 now. And so I think for me, it's taken a long time, and maybe it took me longer to figure out certain key pieces of the journey, which I think for a lot of people, if you know the right steps, I think you can fix it a lot quicker.
I think you started working with Mitch maybe 2 years ago or a year and a half. I don't even remember at this point. And then you've been flying on your own for a good period of time now, exploring and figuring things out. I guess so people listening know, what's your function like now versus before the surgery and versus right after the surgery? What are your hips able to do? What are you proud of? What are you blown away by right now?
Yeah. I mean, a couple things come to mind. One is fun, and let me just say, I'm still restricted. I'm working out of pain. Like on a positive note, I walk 10 miles with my dog. I can go on a 10-mile hike,
That's pretty good.
almost
Yeah.
almost pain free, if not in that like 2 pain range. Whereas I couldn't walk to the park. Another kind of cool thing is one of the PTs made me. They were very obsessed with my imaging, uh,
Hmm.
and really took imaging strong. So we analyzed my imaging, and they basically said, Troy, there's zero way that you can have more than 90 degrees of hip flexion. It just isn't physically possible with your bones. So actually, Matt, it's less than that. It wasn't even 90, man. I think it was 70 something. So
They
like
said there's no way you can have more than 70. Wow. Okay.
there's zero way based on your bone shapes. There's zero way that you can physically have the shape. You're gonna run into an impingement, and so I'm sorry to tell you that, but there's just no way. Well,
Okay.
I'm past that now. I have more range of motion than that in my hip. So
Oh, Lord.
um, I'm proud of that. Like to me, that blows that theory out of the water
Yeah.
completely. So hey, if I can have more than 90, I think that I can have full range of motion.
Right.
It might be pretty tough to get there, and I'm realizing, as these dormant muscles wake back up, it's pretty tough. You really have to do some mindful work. Yeah, I mean, I wish it was as easy as doing 3 sets of 10 of clamshells, but I really have to be super mindful during my clamshells, to make sure and pinpoint the right muscle firing. But
Right.
on a long enough timeline, I will get there.
Right.
And so yeah, I'm proud of that. Well, and honestly, yeah, I do have a lot of work to go, but I'm getting out of pain. I was in a state where I would think I was in a probably like a 7 to 9 every day,
Right.
always, almost consistently, if not sometimes that 10 pain. And now I think I'm significantly less than that. I still think about pain quite a bit. And I still recognize that in certain ranges of motion, but it's now I treat it more like a signal. I try to treat it as data or an input of, okay, that pain, why is that pain coming right then? Am I moving something?
Hmm.
Am I compensating? So I try to look at it in a different way. Instead of being
Right.
angry at the pain, I try to treat it as more of a data point.
Right.
Um,
It's your body talking to you, right? Hey,
yeah,
Troy, like maybe you should not be doing this all day, right? Or maybe we could do something a little different right now. How
yeah,
would you make me fire, right? So we got a little bit of time left here, so I want to also jump into really specific advice that you might have for somebody who has been told, "Hey, you have femoral acetabular impingement. You've got FAI. You definitely need to have the surgery. You've been there. So what kind of words of wisdom do you have to somebody facing this?"
I think my best advice to someone that is considering the surgery is really, really just think about the alternative for just a second. Just explore. Did you put in a little bit of effort into that avenue? Have you explored it? It might really sound like the option, and maybe it is for you. But to be completely honest, if you don't have the musculature around your hips to do certain range of motions pre-surgery, if your butt is completely off and flat and you have no glutes, and and then you go and get surgery and expect to be able to do these things, I think the honest outcome is there's probably not a great chance of you coming out of the surgery able to do these things. If not, it might make it significantly worse. So my
Mhm.
advice is to explore and be honest about a couple movements or range of motion exercises and really commit to them. I think for me, like, it was easy to think that clamshells were stupid or leg lifts were stupid, but commit to it. If it makes you feel even a little bit better when after you do a set of these, I think you're onto something, and check into that. So my advice is just please just explore another option just a little bit and be honest with yourself about it. It'll be really easy to want to take that surgery route. I did it. But I'm telling you, at the end of that outcome, if your alternative post surgery, there is potential for you to be a heck of a lot worse. And
Right.
yeah, it's a really hard. I mean, I kind of get a little emotional even thinking about it. So explore another route. Please maybe see somebody that does understand it. There's certain normal ranges of motion in your body, and if you're missing one of those range of motions, that's causing you pain. I mean, Matt, you have a quote here that I say this to myself a lot: muscle dysfunctions in the present are a result or a move of our movement choices in the past. You said that. So, I mean, if you think about poor movement choices in the past are the result of restricted movement now, it really is more of an unwinding process. And so if you're thinking about surgery, really look at your lifestyle and look at you. And are you sitting all day? Are you not activating muscles? Can you squat? Can you lunge? If you're not able to do these things, if you're broken doing them now, I personally don't think that surgery is going to just magically get these better.
I think the challenge people who have pain and range of motion restriction have is they'll see that these restrictions and the pain are indicative of the need for surgery. So is there something that you think from your own story is relevant to that, where, if, say, I have hip pain and I can't squat, I can't lift my leg, I can't feel my butt muscles, the surgeon told me that's because my bone is messed up. How can you reframe that, or what do you think from your experience has shifted that for you?
I truly think, like, be completely honest with yourself. I really had to drop all ego. I had to drop everything and be really honest with yourself about the way you were moving. If you're truly honest with yourself and you look at how you were moving, and you noticed a dysfunction, but in terms of, like, if you're not able to squat pre-surgery, think about the likelihood of shaving bone and being able to squat if your muscles control it, which, I really truly believe that they do. My advice is be completely honest with yourself and real with yourself in that. I know the surgery, it sounds great. I mean, it sounded great for me. But there is normal ranges of motion in certain positions. Your body should be able to go in a certain amount of hip flexion. It should go in a certain amount of hip extension. It should be able to abduct and adduct. And if it can't do these things, you might be in pain. And the surgery, I think, inhibits the muscles more than helps the muscles and makes it harder. So
I think also your story about the hip flexion and being told, hey, there's just no way you could get more than 70 degrees of hip flexion, and now being able to do it, I think that's one that just resonates a lot in my mind right now. Is just the imaging isn't everything. Maybe it's something, but even from the very beginning, your left side was worse in the imaging than your right side, right? And then now, and it didn't have the same symptoms, but now the right side is worse off after the surgery, but you're able to do more than the imaging says you should be able to do. So, I always come back to this with people who are really scared. It's just like, yes, there are images, but, historically in medical science, especially for movement disorders and aches and pains, those don't mean anything. So they mean very little. So
It's funny, Matt. Yeah, I mean, we rely on it, and it's our best way of kind of in the current environment giving something, but it's not accurate. It really isn't.
You might as well be flipping coins or
Yeah, yeah,
drawing cards out of a hat. So to kind of wrap up, you've kind of talked about how bad your hips were. You've talked about how the surgery ended up, how the hip surgery didn't make your hips feel better. You've talked about having a long-term view of where your current strategies are taking you. We've talked about how you've made progress by being persistent, by being consistent. You've really hammered home the need to be honest about your own habits and the way you've been moving in the past. Is there anything else that you think people should hear about? Anything else from your story that you think would be really important for somebody dealing with hip pain, arthritis, or labral tears, whatever?
Yeah, I think a couple things come to mind. Obviously, I guess first I'll touch on the physical component of, for me, and I think hearing other people's stories, diving into this as an obsession, Matt. I mean, I became my own mechanic and dove into anatomy and musculature and all this. I had to figure this out, right? I had a ton of help along the way. Thank you guys so much. I'm incredibly grateful for Upright, for Shane, for Mitch, you guys all incredibly. Thank you. Everyone that's put information out there in this world, thank you so much, because you guys give so many people hope. And I know there's more people like me. So thank you guys so much. So on the physical front of that, the glute muscles are so important. So if you want an 80-20 of this whole thing, if you want the Pareto principle here, your glute muscles are so incredibly vital. So if get your glute muscles firing properly, and that is way beyond glute bridges. I'm sorry to say that, but get your glute muscles, specifically probably your glute med, get that firing, research your glute med, get that working properly. Make sure you can feel that firing and doing the exercises. That, I think, will get you on the right track. At least you get you going in the right direction physically. And then I do advise getting in contact with someone that can take a look at your body and that understands musculature and it can understand how it's moving, because it's complicated. It's a complicated process. As one piece of your body moves, it's creating torque or potential dysfunction down chain, up chain. So it's really complicated. So, if you can work with somebody that can see that and help you along the way, that's helpful. And then I think the mental piece of it is maybe the last advice I'd like to touch on. And that's, I'm a big fan of habits, and, James Clear, I guess, comes to mind in terms of you choose every day to be the type of person you want to be. And if you want a pain-free life, if you want a unrestricted movement life, you have to start living like an unrestricted, pain-free person. And that means doing certain things. And those might be uncomfortable at first. Like the idea of stretching every day, Matt, I never wanted to do that. It was terrible. The idea of doing clamshells and leg lifts was terrible. 5 years ago, I would have made fun of myself doing that, honestly. But my advice, or if you want to be this person and you're honest with yourself about the person you want to be, there is certain ways that person lives. If you want an unrestricted, pain-free body, you have to do certain things to achieve that. And that is the little daily things. And so I think there's a huge mental component to this. And, when you grasp that, and when you become that person and you embody it, it becomes kind of easy. You want it, you crave these things, you kind of crave the process. And so I think the quicker you can kind of dive into that identity, the better off you're going to be. And for me, I'm grateful for it. I feel like it really catapulted me into my next journey. And in a weird way, like I think that, this happened to me for a reason, that I had to go through this in order for me to help other people go through this as well. And yeah, I've gone through it from a super dark, unrestricted, not frozen hip to, I'm making progress daily. So yeah, I guess that's what I'd say.
Awesome. One thing that I've said this to friends before, which is, when you're dealing with darkness, we're often afraid to go into darkness, and we don't want to talk about dark things, and it's dark stuff. It's not that fun, whatever. But seeds grow in darkness, and seeds of really great things come out of the darkness. And it's really important to remember that, whatever dark period you're going through, something good can grow from that. And especially with, physical pain, there's a signal, there are things to learn, and you will grow if you can be with that darkness and let it take you to where you should be going. So I really appreciate you taking the time to talk about, these dark periods and how you've been working your way out of it. Your story is super inspiring, and I hope that people who are listening get a lot out of it. You've also been talking with me about helping other people, with this journey. Is there a website that people can find you at, or some other way to get in touch with you?
Yeah, absolutely. I am moving into a kind of a coaching role for me. So check out chasingthetension.com. That's going to be my website. And yeah, if you're looking for coaching or some guidance around FAI, even if you're considering surgery, hey, reach out to me. If you need a sounding board, if you need someone to, bounce some things off of, I went through it. So chasingthetension.com, reach out to me.
Great. So I'll put that in the show notes, and that's going to do it for today, guys. I hope you got a lot of helpful information here, and I hope you always remember that pain sucks. Life shouldn't. All right, I hope you found that interview really helpful and inspiring. I'm going to leave links in the show notes so you can find Troy and you can find the FAI Fix program, which will help you help yourself out of hip pain, especially if you have the FAI diagnosis. If you liked this video, please click the like button, subscribe to the channel, share this with somebody you know who's going through this decision-making process about hip surgery for FAI. And as always, I hope you remember that pain sucks, life shouldn't.